Hello, everyone. Welcome to another episode of Mental Health and Makeup. I am your host, Jasmine Young, a board certified psychiatric and mental health nurse practitioner. And on the show, I come to you when I do my makeup and I talk about mental health. Today, we're going to be talking about acute stress disorder. So, COVID brought on a lot of stress. That's an understatement. And since COVID has happened, there are a lot of people that have not been able to function in life. And they've been having symptoms mostly of PTSD, but we're going to get there, okay? So first there's acute stress disorder. When you have been exposed to a traumatic event. And if you cannot get back to some semblance of feeling normal within a month, then it goes over into adjustment disorder. That can last up to 3 months. And then after that, if you've had this adjustment disorder and you're still having signs of nightmares and flashbacks for over 6 months, yes, you have PTSD. And so I want to go over acute stress disorder first because I want to know if you all have been thinking about this and if you all have the symptoms. Okay, so acute stress disorder, and I'm coming out of the DSM, the Diagnostic and Statistical Manual, and I want everybody to kind of follow along and just take notes, okay? I got my eyebrows done the other day. I hope they look okay. But anyways, acute stress disorder can happen to any of us, okay? It's when you've been exposed to actual or threatened death, like with COVID, with all of us, serious injury, or sexual violation in one or more of the following ways. So directly experiencing the traumatic event, like, with COVID, some of our family members passed away and some of our friends passed away. RIP to all the COVID victims. And my heart goes out to the families and friends who lost family members when COVID hit and who are still losing family members because COVID is not over. Okay, that's a totally different subject. I don't want to go there. But directly experiencing the traumatic event, also witnessing in person the events as it occurred to others. So the event that happened with George Floyd, the people that were there that witnessed it, these symptoms may apply to them. Also, learning that the events occurred to a close family member or close friend. When you learn of something that happened to your family member or your friend, that's traumatic. It can be very traumatic. Note, in cases of actual or threatened death of a family member or friend, the event or events must have been violent or accidental. So like, a car wreck, that maybe you lost a family member or a friend. God rest their souls. You've been exposed to this. You've heard that this happened to your family. Number 4, experiencing repeated or extreme exposure to aversive details of the traumatic events. So basically, someone telling you exactly what happened and giving you details. You think about this in your mind and you may react a certain way, okay? And it may cause a disorder. All right, also, presence of 9 or more of the following symptoms from any of the 5 categories. So we're going to look at these 5 categories, okay? And within the 5 categories, we're going to take a look at the signs, the associated signs and symptoms in those 5 categories. Okay? And if you have 9 or more of the following symptoms from any of these 5 categories of intrusion, negative mood, dissociation, and we'll get to that exactly what that is, avoidance and arousal, beginning or worsening after the traumatic event occurred. Okay, let's talk about them. Intrusive symptoms. So what are those? I want y'all to get your writing pads out. Okay, and I need to do a disclaimer when I say get your writing pads out. This is not intended to diagnose anyone with anything. It's just for educational purposes only. And just so you all know what's going on with your mental health, And I'm telling you, all of us have been exposed to COVID. So we've all potentially had a traumatic event happen. You know, whether it was watching the news and hearing about all those deaths going up and increasing, and then in your county, in your town, in your neighborhood, hearing about all that death all the time and seeing it. Nurses, doctors in the hospital, people on the front lines in the hospital, and then NICUs and ICUs having to experience death from COVID. Could have definitely gone through acute stress disorder. Okay, but there is help for this. So let's get back to the symptoms. All right, so we have intrusive symptoms. These are the categories. We have negative mood, dissociative symptoms, avoidance symptoms, and arousal symptoms. All right, so in the intrusive symptoms, what does intrusion mean? Intrusion. It makes you think of like entering into something, right? Intrusion. Recurrent, involuntary, and intrusive distressing memories of the traumatic event. So you could be going along your day just fine. And then all of a sudden, you have a thought. Like, what? That's an intrusive thought. It's not elicited. You know, you don't mean to think about it. It's just an intrusive thought. Okay? Recurrent, involuntary, and intrusive distressing memories of the traumatic events. In children, repetitive play may occur in which themes or aspects of the traumatic events are expressed. So yes, parents, if you're seeing that your children are acting out something that happened, some type of tragic event that happened, they could definitely have acute stress disorder. And you all will have to go and get them some help, okay? All right. And yes, I'm going to be talking about across the lifespan, okay? All right, also, recurrent distressing dreams in which the content and or affect of the dream are related to the events. So, yes, we can call this a nightmare if you're reliving this event in your dreams. Yes, this could be called a nightmare. Dissociative reactions or flashbacks. So say you're just kind of chilling, working. And this happened to me when I had my C-section years ago. Just chilling, working, you know, about 10 weeks, maybe about 8 weeks after my C-section. I was just chilling out, working, and then the phone started ringing. Ugh. And then everything started going haywire at work. The bottom just fell out. Has that ever happened to you all? Not at my job right now, but this is jobs ago. Of course, my daughter is about to be 9, so this is jobs ago. So yeah, I'm just sitting at home, working at home, and stress starts to come. I start to feel very, very stressed at work. Then all of a sudden, I'm back on the table. I'm back on the operating room table, literally in my mind. Now, I wasn't there physically, of course, you know, but I was there mentally, and I was literally feeling everything. Feeling everything about the C-section, going through the emotions again, having a flashback. You know, I could even smelling my burning skin. It smells like bacon. It smells like pork. Like bacon frying. But anyways, so dissociative reactions or flashbacks in which the individual feels or acts as if the traumatic events were occurring or were recurring again. Such reactions may occur on a continuum, with the most extreme expression being a complete loss of awareness or of present surroundings. So that's what happened to me. Yeah, I completely lost sense of my surroundings and during the times of stress when I was at work. And I mean, I didn't really know what it was at the time because I wasn't in behavioral health, but man, do I know now? Yes, I do. And so I was experiencing an acute stress disorder at that time. Now, I was experiencing one symptom of acute stress disorder because we're looking for 9 or more of these symptoms, okay? All right, intense or prolonged psychological distress or marked physiological reactions in response to internal or external cues that symbolize or resemble an aspect of the traumatic event. That's just saying prolonged psychological distress. You're just distressed about it. You can't let it go. You're constantly thinking of this, and it's prolonged. Everyone else has kind of been coping well, but it's prolonged for you. And you're not coping well. All right, let's talk about negative mood. Are you all writing these things down or at least writing how many you may have suffered, because I'm telling you, COVID was a traumatic event for the whole world, guys. And I just want to help you all out, okay? Because COVID was a very traumatic event for us. All right, let's talk about negative mood. How has your mood been lately? Mine has been a little iffy. And of course, if you're close to me, then you know why. And I will discuss that at another date, at a later date, because I've been going through some things my own self. And my mood has been down and depressed and lethargic. And I haven't been able to do the things that I need to do, like come to you all with this show and to get this information out there. But I'm better now. I'll definitely be talking about what's been going on because it's relevant to the show. I just have to do it in my own time, and I have to make sure that I protect the innocent people involved. Okay. But anyways, I digress. Enough about me. Let's get back to you all. Well, and me too. Because I think I've had acute stress disorder before. Because I definitely had these flashbacks of my C-section. Definitely. I didn't have the dreams. I did have intrusive, distressing memories. Yes, I did. All right, let's talk about negative mood. All right, my mood has lifted. It's a little bit better. And it really wasn't a bad mood. It was just a mood. Okay. Persistent inability to experience positive emotions. That sounds kind of sad. And they're basically saying the inability to experience happiness, satisfaction, or loving feelings. Sometimes people come to me and tell me, I just can't feel anymore, Jasmine. Well, they don't come to me. You know, they come to the clinic. They don't just walk up to me and tell me these things. But yeah, they say things like, I just don't care about anything. Nothing is satisfying anymore. Like, I feel like I can't love. I feel like I'm just flat. After these bad things have happened, it's like I cannot experience happiness or satisfaction in anything. I'm not satisfied. I'm not happy. And I don't know why. Like, you know, I wasn't directly affected by death of COVID. This is what they tell me because I was. But, you know, Jasmine, I wasn't directly affected, you know, by COVID. I didn't lose my job and I didn't, you know, lose a family member. I didn't get sick, but, you know, I still feel like there's no happiness and I don't have any satisfaction in life. And so this is your average person, you know, after COVID, especially now that we're trying to get back to some semblance of reality, that after COVID, and is COVID even over? They're talking about some Delta variant. Oh, we're dealing with so much these days. All right, so have you had a persistent inability to experience positive emotions? Okay, check that. Put check right there for that one, okay? Dissociative symptoms. All right, dissociating is, have you ever dissociated? Dissociating is when you kind of take a back seat to your reality and you say, it feels like you may perceive things as slower, like happening slower, or like a lot of people tell me it feels like a dream. They're like in a dream-like state. And, you know, they're also having this altered sense of reality. So altered sense of reality of one's surroundings or oneself. Seeing oneself from another's perspective. Isn't that something? I start thinking. Okay, have you all ever seen people on the road or seen people and said, I wonder what their life is like? It's not like that. That is not dissociating, okay? It's you, your own self. You're having issues with seeing things or just floating away for a moment and not having that reality of your surroundings happen. So seeing oneself from another's perspective, being in a daze and time slowing. That's exactly what I'm talking about. It's called dissociating. Usually we see that when someone is under a lot of stress. I have one story about dissociative identity disorder. And it's real. It's definitely real. I know some people call it multiple personality disorder, but it's dissociative identity disorder. Ah! Can't get some of these things out of my mouth. So, taking a back seat to be an active participant. If that's ever happened, you've basically been exposed to some trauma that you need some therapy for, okay? Inability to remember an important aspect of the traumatic event, typically due to dissociative amnesia and not to other factors such as a head injury, alcohol, or drugs. So something bad happening, and you basically can't even remember the events because you've repressed those memories, and that's sad. Do you have repressed memories? Here comes a part where I can't talk, but think about it. Repress, pushing it back, memories. Well, it must have happened around trauma, right? Why would you be repressing memories? We don't repress good memories. We only repress bad memories, correct? Right. All right, so far we've gone over intrusive symptoms, negative mood, and dissociative symptoms. Now we're coming to avoidance symptoms. Efforts to avoid distressing memories, thoughts, or feelings about or closely associated with the traumatic event. So you don't want to have any memories about it. You're putting efforts to avoid those memories. You're like, no, I don't want to think about that. Also, efforts to avoid external reminders like people, places, conversations, activities, objects, situations that arouse distressing memories, thoughts, or feelings about or closely associated with the traumatic events. So, recently, my family and I recently witnessed an accident. So we didn't witness it, but we came up right before the emergency vehicles came up. And, right before the ambulance came up. And basically we saw a crumpled up motorcycle in the middle of the doohickey, in the middle of the roadway. And I'm sorry, I laughed because I said doohickey. Do y'all know what doohickey means? Anyways, so we come up on that site, and I told the kids, I said, kids, close your eyes. But I had my eyes open because I just wanted to see, which is like, why do we want to see accidents? Why do we want to look and see? I don't know. Human nature. You know, we're in traffic, we're waiting, and we've waited for so long, and then we're like, this better be good. You know, better be a good accident. Oh, look, guys, I'm just telling the truth. I'm sorry if I'm stepping on people's toes. But that's human nature. You know, that's why when there's an accident on the side of the road, you know, you're like, beep, beep, hurry up. Get out of my way. Move, get out the way. And you see, it's people rubbernecking, wanting to see what's going on with the accident. So I remember going the same way on the road a couple times, and every time I think, oh no, I don't want to go that way. I don't want to go that way. Let's find another way because I don't want to re-experience that. So going out of your way to not, you know, remember that memory, to not associate yourself with people, places, conversations, activities, objects, situations. You try to just avoid it because you know that as soon as you get up there to that intersection, Jasmine, that you're going to have that flashback of that bloody body under that sheet. I'm having a flashback now. Bloody body under sheet. R.I.P. motorcycle guy. Because, man, my heart just went out to you and your family. I thought, oh, my gosh, somebody's family just left the house. Family member just left the house and they're not back. And they don't know what's happened to them. And somebody's about to have the worst day of their life. And so, maybe I did have acute stress disorder. Okay. All right. So don't try to diagnose yourself, okay? Go see your doctor, okay? Psychiatrist. All right. Let's talk about arousal symptoms. And I'm not talking about the kind of arousal that you all are probably thinking about. Get your mind out of the gutter. But I'm talking about arousal as in sleep disturbances. You know, unable to sleep, insomnia. There are different types of causes of insomnia, but difficulty falling asleep, difficulty staying asleep, or restless sleep. Okay. And then this is where some of those nightmares may come in too. The cause of the restless sleep or racing thoughts at night. So we put all of the conglomeration of symptoms together, okay? Irritable behavior and angry outbursts, okay, with little or no provocation, typically expressed as verbal or physical aggression towards people or objects. So you ever see someone that has experienced trauma and they just lash out? That's those arousal symptoms. They're lashing out, they're getting aroused, and not in a good way, not a good arousal. They're getting aroused in a bad way. And this is a pathological thing that's happening. It's a bad thing that's happening, a maladaptive coping behavior. A way that people can cope, with trauma, with traumatic events. They may act out. Okay, is that you? All right. It's okay if it's you for a little bit. Don't let it last a long time, okay? Don't let it continue. All right, get some help for it. All right, hypervigilance. You all know any hypervigilant people? People that are just like revved up, amped up. They can't, be calm. They're hypervigilant. They're all over the place. And you say, what is wrong with them? And they, that they've been through something traumatic, and you see them hypervigilant. Maybe they're just doing too much. They're all over the place. They rush. They're impulsive, and they're just amped up, keyed up, and they just can't calm down. This is different from like a bipolar disorder. But hypervigilance, problems with concentration, don't we all at times? But we're looking at a conglomeration of symptoms after this perceived occasion or threat, event, traumatic event. And exaggerated startle response, where somebody says boo, and you say ah, like you're really, really scared. You have this exaggerated startle response, where you really, you ever see people like on Freddy Krueger movies, or one of those movies where they're just off looking in the distance and they're in class and someone says hey, and they're like ah, and they fall out of their desk. Yes, that's exaggerated startle response. These symptoms, okay, so the symptoms that we just went over, they would happen and occur within, a few hours or so after, or immediately or a few hours after the trauma, but persist for at least 3 days and up to a month, okay? So it's not something that's just going away, okay? It's going to persist. All right, and the disturbances causes clinically significant distress or impairment in social, occupational areas. So like you can't function. You're not able to function. Or other important areas of functioning. Like even if it's not at work, or even if it's not when you're out, but at home. If you can't function, you can't get up out of the bed. You can't exercise. You're having issues with a lot of different things. You can't function. And the disturbance is not attributable. The disturbance is not attributable to the physiological effects of a substance. So you're not drunk. You're not high. We got to let that dry a little bit. And you're not on any type of medication, you don't have any type of medical condition like a mild traumatic brain injury. And it's not better explained by brief psychotic disorder, because some of these actually, yes, can be explained by other disorders. And so if we can't stick this if we can't attribute this to a different disorder or another disorder, then yes, it is definitely acute stress disorder. So you say the treatment for acute stress disorder. How do we treat it? Number one, therapy. What's wrong with y'all in finding therapies? What is up, guys? Therapies, different therapies, like finding a therapist. I always say, man, if we could just have, how we go on like dating, we as a people, not me, because I'm married. We go on these dating sites, and you kind of put your information in or something. I mean, I guess it goes that way. And then they come up with somehow, like at Match.com, you put stuff in and then they come up with like your mate or whatever, or whoever you're supposed to date or whatever. I wish we had something like that for psychiatry, you know. So can someone please come up with that? I mean, I know it's my idea and some people say, you do it. Maybe I will, because I'm hearing a lot of people having a lot of problems finding a therapist. But the first thing I want you to do is find a therapist, okay? Find a therapist to be able to talk to. And see, the therapists, they usually will help patients identify when it's time to think about taking a medication. Because if you need medication help, just take the medicine. You know, if you don't want to take the medicine, don't take it. You know, but if you need help and you can't do it alone, don't feel bad about that. Just take the medication. Just take the medicine. It's there to help you, okay? A lot of people think they're going to be taking psychiatric medication for a very long time, and that is not the case, people. That's not the case. You take it, you know, and the standard of care is you take the medicine, you know, and yes, I prescribe medication. A lot of them can help with acute stress disorder, but you take your medicine, you get your therapy, you know, and you try to come off the medication 9 months to a year later. And during that time, you're going to practice using your coping skills, you know, using what you learned in therapy to cope with life. So you don't have to be on medication for a long time. Now, a lot of people say, I don't want to do the work. I just want a medication. Well, if you don't want to do the work, you're going to end up being on medication most of your life until you do the work, okay? Don't run away from the work. You got to do your work, okay, on yourself to identify triggers and to come up with coping skills. All right, so yes, acute stress disorder is treatable, and it's something that I treat, and I'm seeing more frequently now that people are out and about, and COVID has come to a slowdown. It may not have stopped yet, but I am seeing acute stress disorder. And like the book says, 3 days and up to a month. Okay, so if you've been feeling 9 of these ways out of those 5 categories, and it's been over a month, you may have an adjustment disorder, which we'll talk about next time. I am all ready, it seems. Okay, y'all, I just had to kind of put this together. I don't know, is it okay? Kind of had to put this together since my hairstylist is out of pocket lately. He's been traveling around. So hopefully I can get this hair done soon when she comes back from all her travels. But guys, it was really good getting ready with you all. Piper already opened the door and is asking mommy, mommy, mommy. So let me go. But I will see you all next time on another episode of Mental Health and Makeup with your host, Jay Young.